This is Brent of the Brookbush Institute, and in this video we're going over another special or orthopedic test for sacroiliac joint pain. This is the thigh thrust test. I'm going to have my friend Melissa come out. She's going to help me demonstrate. Now I think you guys will find that the trickiest part of this test is setup, and it all comes down to trying to get this hand on the sacral base. Now notice that Melissa is in supine, and it should be that wherever she's having symptoms, the sacroiliac joint that we think is involved is further from us. And what we're going to do in this test is I'm going to brace her sacrum with this hand, and then using her thigh, I'm going to create a posterior force that's going to take her pelvis and shear that joint. Right? So we're going to shear the innominate on a stabilized sacrum. So now the question is, how do I get this underneath your sacrum? And this is where all sorts of awkwardness happens if you don't do a little practicing before you see a patient using this test. I'm going to lift this leg up. I'm going to then pull Melissa over towards me. This way I can put my hand into position this way and roll her back over my hand. Guys, don't try to slide your hand underneath their backside. That is not going to gain you any rapport with a new patient or client that you're doing an assessment on. Now, I will say it is a little tricky to get this hand in the right spot. Because remember, we have to stabilize the sacrum, but not the innominate. If you put this, like let's say that the sacrum ends up on this side of my hand and like her PSIS of her innominate is on this side of the hand and I push down, nothing's going to happen. I'm just going to push both of those things right down into my hand rather than me having the sacrum in this hand with the innominate coming off the edge. All right, so what you're going to end up having to do is try to kind of find her ilium and then maybe her PSIS, as we've been using that bottom corner of the PSIS as a landmark, and then try to get medial to that PSIS. Now, it's okay for your hand to end up all the way on this innominate. That's fine. I can stabilize her, in this case, left innominate and sacrum, and then push her right innominate over the edge. What I can't do is have sacrum and right innominate stabilized. So for those of you guys with bigger hands, what you might want to do is kind of find, even if you had to, the middle of the sacrum and then roll them back. And I just missed a little bit. Let me get a little further over. Right? Now I can feel I have her sacrum stabilized, right? But all this side is hanging off the side of my hand. Now I'm going to use this arm. Notice that my elbow is in line with the direction that I want to push, and I'm going to do a little thrust. Right? Did that provoke your symptoms? No, that didn't provoke her symptoms. All right, and I might give it a couple. How about that?
Almost.
Almost? You feel like there might be something there? All right, and if you guys can, if you happen to be tall enough, different enough size, you could try giving like more of a thrust with your torso. How was that?
Okay.
Okay. All right, so she's probably not positive. She's only getting kind of a hint of uncomfortableness, which it's a special test meant to provoke symptoms. It's probably not going to be that comfortable. So let me review that setup one more time. She's supine. The side that we think is involved is furthest away from me. I want to get this hand on her sacrum. I want this innominate hanging off my hand. So the way I'm going to do that is pull this leg up like this, tilt her really far over towards me. Notice, guys, I'm bracing my thigh right against the table so she can't fall off the table. I'm then going to bring this hand down. It's okay that I stabilize the opposite innominate as long as I get this part of my hand over her sacrum and this pelvis is hanging off. All right, so I found her PSIS. I went off medially. Now as I roll her back, I just got to make sure that my hand doesn't slide over with it. Now I can feel that her sacrum stabilized and this side moves. Once I'm there, I'm then gonna make sure that my elbow's in line with the force I'm trying to create. And I'm actually using my chest here to kind of stabilize her thigh so it doesn't move around on me. And I give her a good little thrust. How'd that feel? That didn't provoke any of the complaints you were talking about when you walked in? Remember, guys, we're not just looking for pain, uncomfortableness, soreness. We're looking for the concordant sign, the complaints that she walked into the office with. So there you guys go. This isn't a great test, as most SI joint tests are not great tests. They tend to be pretty specific. If they are positive, they probably are sacroiliac joint dysfunction. But all of these tests have a hard time with sensitivity. This is one of those tests that is going to be used in our clusters though. So keep this test in your repertoire. Get some practice in with that hand positioning. It's, as you can imagine, it could get a little awkward and maybe a little inappropriate, kind of fast, absolutely accidentally. Grab a couple of your colleagues who know of the test and get some practice in before you try this with a patient. Guys, I look forward to hearing about any questions you have in the comments box below. I'll talk with you soon.